No, I'm super curious too. Like, what metrics or like feedback loops do you use to gauge whether GRIN is actually delivering on its equity goals?
Yeah. Um, KPIs, again, speaking like a true, I guess, operational manager and product manager, this is my favorite topic. How do we look at the data? And how do we, make sense out of the data? And how do we continuously improve over that data? So this is again something that I hold myself at the highest standards as well as our team. But if there are a few things that, just to answer your question, number one is efficiency. So we have to make sure that whatever the care team and the providers who are using our tool, we're not making them we're making them faster, we're making them better, we're allowing them to basically see a larger amount of patients. And so efficiency is one of the key things that we're looking at. And I'm proud to say that we've done some studies and using GRIN and scanning patients in remote areas. We were able to achieve results of 2 times faster in their workflows. Now, 2 times faster might not mean much, but in the grand scheme of things, that might mean that I've returned 3 to 4 hours a week for them,
Mm,
or sometimes a day, where they can see more patients or do other things. So that's on the efficiency side. The second thing is actually measuring the lives touched. So were we able, thanks to GRIN, allow these providers who are out there in the field to see more patients? Were we able, thanks to having GRIN, allow a provider to consider going to distant location, going to another long-term care facility because they feel empowered and enabled because they have GRIN. The other thing, which is also a very high metric that I love, or a very high importance metric that I love, is behavioral change. So we talked about preventative activity before that, and how do we drive change amongst communities when it comes to taking care of their oral health. One of the things we were able to do with GRIN is we ran a study where, using GRIN in tele-dentistry communication, where you have a clinical provider on the other end discussing with the patient on how they could do better in terms of their oral care, are we able to see change over time? And guess what? We were able to see that in a study where in this case, I think we had 1,000 subjects, where we showed that over a course of 6 months to a year, if there is intervention by a care professional on the other side that can see what's going on in the patient's mouth and asking them to change habits, we actually saw that there's a 53% reduction in plaque pixels in their mouth. So think about it. Now these patients are healthier. And it's all thanks to a very simple activity that they did of taking an image of their mouth and having, an asynchronous intervention from a care professional on the other end. And then the last, I think you asked me about KPIs. I think that maybe another very important KPI is, are we able to reduce the health system burden? So from the health system burden, are we able to reduce kind of the cost of care on an individual basis and on a population? And then are we able to reduce, and then from the other direction, as from a patient perspective, are we able to reduce their health system burden by saying, okay, now I don't need to take a full day off work in order to travel to be monitored or to be seen by a provider that doesn't, and have to go back and forth, back and forth. I can do that in a more efficient way and maintain my health, basically. So I hope I answered your question, but
you
I have
did.
a lot to say about, performance metrics and how we measure, our influence and